Okay, today we're going to answer, so how does exercise compare to surgery when it comes to treating your torn rotator cuff? So to answer that question, you've got to start looking at randomized controlled trials, okay? These are a certain type of research study that can provide the highest form of proof in medicine that a treatment is or isn't effective. So in a nutshell, the randomized controlled trial takes a group of people with a problem and it randomly assigns them to either a treatment group or a control group. Sometimes the control group gets no treatment, other times it gets a treatment. So in terms of finding out which is better for treating your rotator cuff tear, exercise or surgery, subjects would randomly be assigned to either have surgery or to try exercise. So let's take a look at a few of these studies. 160 patients with either a partial or full thickness rotator cuff tear were randomly assigned to one of three groups: exercise, surgery, which is acromioplasty, and exercise. Okay, so here is exercise, surgery, and exercise, or exercise, acromioplasty, and a rotator cuff repair. Okay. So here again, like I say, this is just exercise. This is where they remove part of a bone, okay, so you don't get impingement, and exercise. Or you do all three of them together: exercise, remove part of the bone, and the rotator cuff repair. Subjects were followed for 2 years. The results, all groups did the same. There you go. Yet other studies have followed groups for longer periods of time in order to get a better idea of how people really do over the long run. In this study, 103 patients with a tear no bigger than 3 centimeters were randomly assigned to an exercise group or surgery to repair the rotator cuff tendon. Researchers found that the difference between the two groups were small at 5-year follow-up. Well, there you go. So these are just a couple studies. So what does the published literature as a whole have to say about exercise versus surgery for your torn cuff? Answer that, we turn to a special kind of study called a meta-analysis. In a meta-analysis, researchers search all the literature and find all the studies on a topic and then combine the data from them to find common results and identify an overall trend. Here's one. Researchers in this study searched the entire literature in a systematic review and then did a meta-analysis of all the randomized controlled trials comparing exercise to surgery. Their conclusion: exercise was as effective as surgery in improving quality of life, disability, and pain for large to massive rotator cuff tears. All right. One last thing. Rotator cuff tears can be classified as traumatic, meaning that they are tears caused by some type of sudden injury like falling or lifting away, or degenerative, meaning that they just tear due to normal wear and tear. I point this out because symptoms you will hear that acute traumatic rotator cuff tears are best treated with surgery. Well, here's some food for thought. 58 patients with acute traumatic rotator cuff tears were randomly assigned to either a surgical repair or exercise. Rotator cuff tears range in size from 4 to 21 millimeters. 1 year follow-up showed no differences in outcomes between the surgical and exercise group. Okay, so these are for traumatic ones. Like I say, a lot of times people are like, oh, this is a traumatic injury, it's best treated with surgery. Well, that's not what this is saying. So looking at the literature as a whole to answer our original question, how does exercise compared to surgery when it comes to treating a torn rotator cuff, the overall conclusion is that over the long run, treating your rotator cuff tear with exercise can get you the same results as if you had surgery. There you go. One last point: even if one does have surgery, they will eventually be doing exercises anyway, as most surgeons are going to put you on an exercise program following surgery. So either way, you're going to be doing exercise, right? Yet another reason to go ahead and try an exercise program first. So that's according to the literature.